Story 1. I was a therapist for people with psychosis and schizophrenia. Men were more likely to have religious delusions, such as believing they are God or that God speaks to them. Women were more likely to have romantic delusions, such as believing a celebrity speaks to them or that they are pregnant by a miracle. Both men and women experienced similar levels of dissociative issues, such as believing the world is not real, humans are being replaced by zombies, or that someone is not their real parent. Story 2. I work with foster children aged 2 to 18, providing therapeutic mentoring and placement stabilization. Up until about 9 or 10 or 11 years old, there are no discernible differences. Preteen girls are more likely to seek control by refusing to see me or talk to me. Preteen boys are usually happy that I am taking them out of the house. Meanwhile, teen girls are usually glad to have someone actually listen to what they have to say and are very open. Teenage boys will seek control by trying to make me uncomfortable. They may behave inappropriately by making sexual comments, telling inappropriate jokes, or being mean. Story 3. For me, men opened up faster. The first visit or two might be very limited, and then the floodgates open all at once. Women are more open at the start but reveal significant details much more slowly. Story 4. Men frequently schedule their first appointment because their wife or girlfriend strongly encouraged it. It is rarer for them to reach out on their own initiative. Story 5. I dated a sex therapist. She said that if a couple came, it was generally because she wanted him to read her mind, and he wanted an instruction booklet. If it was a single man who was 40 or 50, he wanted his body to respond like it did when he was 17. Story 6. 20 years ago, gender differences in therapy was an area I researched. A couple of general differences were a tendency for males to underrepresent, that is, they would say they were not feeling as badly as they were, or that they were satisfied with the therapist when they were not, or happy with them when only moderately satisfied. The other general point was that males presented less verbally than females. Alexithymia was also much more common in males. The inability to identify emotions and therefore to explore them without professional support was absolutely crippling for many. This was observed in sessions rather than as part of traditional structured research. Story 7. Honestly, there are fewer differences than you might think. Men tend to be more comfortable expressing anger than women and often have less of a support system and less openness about their mental health with people they care about. However, this is more a result of societal conditioning than a definitive truth about gender. Paradoxically, I often find men to be more attached to romantic ideals than women. Story 8. My male clients come to therapy wanting solutions, action, structure, and for me, a woman, to tell it like it is. Over time, we almost always end up exploring psychodynamic approaches, including extensive talking, open-ended guiding questions, raising awareness of relational and childhood experiences, behavioral patterns, and processing deeper issues they did not consider relevant or were not given space to discuss before. My female clients are often high-performing, controlling, perfectionist, burned out, and trying to approach therapy and healing perfectly. Over time, we work on self-acceptance, processing anger, setting boundaries, values-driven action, self-image, and raising awareness of gender roles in capitalism. My female clients are frequently very self-aware when they meet me. They understand their experiences and emotions and know how to discuss them. What they need is a safe relational connection with a therapist who can gently challenge them to be honest with themselves. Growth involves discomfort, so we cultivate tolerance for examining the self and barriers to change. Story 9. I work with many college students, and men often take breakups much harder and are more likely to cry about them. Story 10. I treat people with co-occurring substance abuse and mental health issues. After 20 years, I don't think I could really say much. Everyone has underlying issues that drive behavior. If they have trauma, a personality disorder, or an anxiety disorder, each person presents differently. It is not specific to gender. It is based on history, coping skills, insight, and judgment about what is happening. Story 11. I have learned that men need support and encouragement to thrive. Constant criticism is hard on a man. It causes him to lose his confidence, and in that situation, he has a hard time relating to his partner. Women, on the other hand, need attention. They need to feel seen and heard. They do not need to be understood as much as they need to feel heard. Women usually do not accept excuses. They want acknowledgement. When a woman is not feeling seen or heard, she does not feel loved and has a hard time relating to her partner. Story 12, Therapy Intern here. One of the biggest differences I have noticed is how anger is presented. Many women I work with often feel repressed anger that they deny until it explodes, or they are completely unaware that they have an anger problem. They may also deny expressing anger for fear of being labeled sensitive or hysterical. Men, on the other hand, are conditioned to believe that anger is the only emotion they are allowed to show. They often deny depression, anxiety, and other negative emotions that underlie that anger. Some are so afraid of becoming like the other angry men in their lives that they deny themselves the expression of anger altogether. Story 13. I have worked with children and adolescents in both hospital settings and outpatient community mental health centers. I have noticed a significant increase in teenage and preteen boys with suicidal thoughts and intent in the past year. Among girls, I have observed a notable amount of anxiety, especially social anxiety and performance-related anxiety. Story 14. Gendered problems are quite common among my clients, or at least feature heavily in their clinical needs. I have seen women whose life problems are frequently attributable to beliefs, events, and relationships derived from patriarchal society. Some women struggle with making friends because they find it difficult to deal with the prevalence of social aggression in female friendships, particularly autistic women. Some tend to overgeneralize their reasonable fear of the dangers men pose into avoidance of men even when they want to be in a relationship. Others struggle with attractiveness expectations toward women, either by failing to meet them and experiencing body image and self-esteem consequences, or by succeeding and then finding it difficult to navigate the consequent objectification by men and women in their lives. In men, I have seen problems related to loneliness, including a lack of meaningful friendships, difficulties or disinterest in expressing emotions to friends or partners, callousness in romantic relationships and views of women, likely encouraged by the internet community known as the manosphere, and fears of being a burden on society and their families, often reinforced by pressure from their wives or girlfriends. Some men's overgeneralized negative views of women, such as believing they are too stupid, materialistic, or shallow, lead to problems in relationships across their families, friends, and partners. These issues are common on the internet, but the gender conflicts also play out in the therapy room. It is unfortunate because the systems in place create these problems, but there is little therapists can directly do to treat the source. The most effective approach is to help the individual develop skills and attitudes that buffer them against the worst effects. Story 15. Female patients usually apologize for crying. Male patients usually apologize for having emotions. Story 16. Differences are many, but I find this a difficult question to answer because there are as many differences between different men and women as there are between the sexes. Off the top of my head, women have often been the ones clinging to unhealthy relationships. Men have more often been aggressors. Men tend to devalue social needs. Both equally want to be heard. Most people prefer to talk in therapy, even those who are generally quiet. Story 17. Female patients often feel more comfortable expressing emotions and discussing interpersonal issues. Male patients may take longer to open up emotionally, sometimes framing issues in more practical or action-oriented terms. Story 18. Hope someone sees this. It's been a few hours. Clinical psychologist here. I work with trauma, anxiety, depression, eating disorders, and sleep disorders in adults and older teens. I find the differences fairly consistent with gendered socialization. The men I work with often need a lot more coaxing to allow emotion into the room, rather than keeping things intellectual, theoretical, or problem-solving. They tend to freeze up when strong emotion appears, and very often I can tell their default relationship with strong emotion is shame or general avoidance. Working through that relationship to emotion has to come first. I find that with many of my female clients too, but always with a history of trauma. For example, if you had to go flat or else your drunk father would pick a fight with you, it makes sense that it's hard for you to emote in session. With the men, it's just their default trauma or not. I think that tells us a lot about what society teaches little boys from an early age. It makes me think of that bell hooks quote. I'm paraphrasing, the first act of violence boys must do in patriarchy is self-mutilation of the emotional self. In addition, the trend absolutely holds that the women in my practice tend to be more anxious, more self-doubting, and more concerned with weight, shape, and general likability. They look to others' opinions to define their worth or even their own opinions. Some men are this way too, but typically after more explicit trauma from a male caregiver. Their default is more confidence. For women, I see this crippling sense of not being good enough nearly across the board. This makes perfect sense to me. In patriarchy, women are not granted equal rights, equal ability to earn and maintain wealth independently, or the ability to engage in civic life and contribute to outcomes for their society. So women have, generation over generation, depended on others, men, liking them for sheer survival or to have any control over their circumstances. Finding a partner to marry and reproduce with, or at least a group to accept you, would have been a matter of life and death, or at least of being impoverished or not. So the effort to be attractive to others, especially men, is a matter of ingrained survival, not just being shallow. I see that surviving to this day, even in women who otherwise intellectually hold feminist values or who, in their current life, could actually build wealth without a man. But just because it's changed for this generation does not erase the cultural teachings and epigenetics that have been handed down through generations. It tears these otherwise smart, loving, capable women apart to be constantly bombarded with thoughts about not being good enough, pretty enough, safe enough, etc., when they wish they could be more focused on other things. In line with that, I see a trend, but not a rule, that women are much more likely to blame problems on themselves, and fear, guilt, and shame are primary emotions to show up in interpersonal conflict. With men, anger tends to show up first. I assume this is in part because boys and men have typically not been permitted to be vulnerable. I'm thinking of one of my most beloved clients right now, with whom I've discussed his experiences of shaming at the hands of all of his caregivers for signs of weakness. I think it's also, at times, because men do truly feel more confident and more entitled to their own opinions, as society treats them as full human beings with their own complex, important thoughts. This has often been condescendingly stripped away from girls at an early age, who have been othered, put in a box, objectified, or outright belittled. So women are less likely to jump to anger because they question themselves too much. How can you be angry if you're not sure you're right, or if your opinion even makes sense? There are more observations, but this is what just came to mind. Happy to answer any more specific questions. Story 19. From what I have seen shared, many male patients struggle more with opening up emotionally, while female patients often carry the weight of emotional labor for others. Both face completely different pressures, but it is heavy either way. Story 20. In most couples I saw as a therapist, the woman wants to feel emotionally safe while the man wants to be appreciated for what he is doing. Also, most men do not seem to identify getting angry easily as emotional and only think crying is emotional. More men asked if they could be put on medication, and women preferred talk therapy. Story 21. Formerly a therapist, the biggest difference observed was how many men mentioned being sexually assaulted by women while minors and did not report it to authorities or consider it a big deal, despite their symptoms indicating otherwise. The numbers were staggering. Story 22. I am a therapist who specializes in attachment trauma. I use a style of therapy called internal family systems or parts work. Imagine the Pixar movie Inside Out, but instead of emotions vying for control, they are different parts of you. As some have said, there are often fewer differences than one might assume. A big difference I see in parts work is how comfortable people are interacting with their different parts. In my caseload, I see my female clients doing a great job of showing love to the youngest version of themselves, typically 3 to 6 years old, but struggling to show curious compassion to their parts once those parts are in their teens and early 20s, especially if sexual abuse is involved. My male clients often struggle to accept that their young parts need love and attention, but they are somewhat better at listening to the needs of their teen parts. This is a broad generalization, and every case and client is different. Story 23. When I worked with victims of abuse, I came to understand that there was no difference. When you break a human so much that they are reduced to their core, all that is left is a miserable bag of pain and hate. The way they react does not depend on the gender society assigns to them. Story 24. I feel that many of my female patients become outwardly overwhelmed, for example, by crying or complaining of exhaustion. Men, on the other hand, often say nothing or express anger in those situations. Within autism, I believe women are more overwhelmed by society and tend to withdraw as a result. Men are more likely to attribute ill will, thinking, X looked at me that way, did this to annoy me, or thinks this about me. However, most of their social interactions can be explained in much less hostile ways. Story 25. I noticed my transfeminine friends typically do not feel like they have to prove their identity to me in the way my transmasculine friends typically do. Story 26. In my experience as a therapist, I have noticed some common gender-related patterns in the people I work with. Of course, everyone is different, and I never assume anything based on gender going into a session. These are just trends I have seen over time. My male clients often struggle with their sense of self and masculinity, especially in relationships. There is a lot of pressure tied to being the provider or the emotional, stoic rock in the relationship. Many were raised to believe their value is based on what they can materially contribute, not on emotional presence. Vulnerability is often uncomfortable because they were not given the language or space to express it growing up. Many men also fall into what I call the Mr. Fix-It mindset. This is the idea that if they fix the problem, then the emotions around it, their own or their partner's, will go away. On the surface, that might seem logical, but it is often a way of avoiding emotional vulnerability and deeper connection. Again, this usually traces back to socialization. Emotional avoidance is praised in boys as a strength, and that follows them into adulthood. I have also noticed that some men struggle with accountability in a unique way, not by avoiding it, but by over-accepting it. Some take on all or most of the blame in a conflict, especially with a partner, to smooth things over and avoid further confrontation. On the surface, it looks like responsibility, but often it is a way to bypass the emotional discomfort that would come with a deeper conversation. Anger tends to be a more acceptable outlet for many men, which makes sense considering how they were taught to express emotion. Much of the work is helping them expand their emotional vocabulary and get more comfortable with being vulnerable. I also tend to reframe terms like toxic masculinity into something more approachable, like limiting masculinity. That tends to land better and creates room for growth without defensiveness. Pointing out ways their masculinity has been limited, such as with many of the examples above, helps them reframe their experiences as men and makes them want to actively challenge those limits. Also, that is what toxic masculinity is in essence, a way to limit masculinity to one specific ideal enforced by society at large. Probably helps that I am also a man, so there is a sense of shared experience. Story 27. Men in my practice were much harder to work with. I am also a man, and sometimes it involved unnecessary power struggles. I had one man who was actually angry at me for telling him things, even though he paid for exactly that. Emotionally, men are more like rocks, and it takes more time for them to open up. We had to have many sessions just to reach the point where they open up and understand that feelings are a valid response to what is happening to them. Women were much easier. They are far more connected to their needs. This does not apply to all cases. I had very emotionally open men and closed-up women, but the trend was very visible, especially with older generations. Story 28. Unpopular opinion on Reddit. Abusive relationships tend to fall into two types: coercive control, also known as traditional domestic violence, and situational couples violence. Women tend to downplay situational couples violence, and men tend to be unaware of the severity of traditional domestic violence or coercive control. Situational couples violence can look like a power struggle involving aggression from both sides, although one may be worse than the other. It is quite common, can escalate into mild to moderate injuries. It is usually triggered by stressors, communication issues, or mental health problems. It is unusual to result in post-traumatic stress disorder. In the presence of severe mental illness, the power struggle may involve aggression from only one side, with the other side trying to gain control out of self-defense or concerns for the other's safety. Serious injuries occur, but are unintentional. Coercive control involves dominance of one partner over the other through the use of systematic violence and psychological abuse. Post-traumatic stress disorder rates are double what is seen in combat veterans. Abuse is cyclical. As it escalates, common behaviors include repeated near-death strangulation, traumatic brain injury, killing or torture of pets, constant surveillance through cameras and trackers, and eventually, murder of either partner. Women have a higher rate of violence within situational couples violence. In heterosexual, able-bodied relationships, the perpetrator is almost always male. It is not that women are incapable, they are perpetrators in same-sex relationships and when the male partner is disabled. This is more due to practical concerns such as bearing children, physical size, and lower income. Able-bodied men can usually wrestle away a gun if the partner is hesitant to use it. Story 29. As a therapist, I've noticed that men and women are all individual, unique human beings who cannot be pigeonholed based on gender. Story 30. Working with males in the United Kingdom is often significantly more difficult because they do not understand how to be a client in the same way a female does. You end up spending a lot of time and effort focusing on building rapport and helping them learn how to express themselves in ways they simply have not done or even considered before. However, when the work is successful, it is very rewarding. Story 31. Family lawyer here, not a licensed therapist, but I think I can add to this in the context of divorce since I essentially act as a therapist and safe space too. 1. Men cry alone, women cry as a group. I've noticed that all the men come to me as a last resort when they have tried to solve the problem on their own, usually after years of being oblivious or ignorant. As a man myself, I often feel for them and understand where the miscommunication was, but sometimes it is just a lack of emotional intelligence or complete disregard for the emotions of others. Women almost always come in groups with friends or family and usually have support from many angles. I rarely see a female client suffer through a divorce or separation privately. In fact, I have had a few who, after more than 10 years of marriage, cheat within a few days of separating. Maybe it's a societal thing, but strictly speaking about emotions, I have noticed that men tend to suffer longer and harder. 2. Women's storytelling is flowery and interesting to hear. Men cannot communicate accurately, but we all struggle at being objective. From my experience, women give me all the details of specific dates and storylines, making it sound very real, whereas men, when I ask for details, usually give a vague answer that amounts to "I can't remember" or "I don't know." The most interesting part of their communication style is that both men and women struggle to keep stories straight. I give a write-up to the other lawyer, and the other lawyers give me a write-up of their client's side. Nearly 100% of the time, when I read the other lawyer's write-up, there are gaps in the story, and my client will say, "Yeah, that happened, but they are twisting it." When I question the absolute facts and cut out the emotional side, more often than not, the answer is yes, that happened. It is scary that human perception can distort facts like that. 3. Women tend to pay money faster. Men tend to pay more. Women tend to want results faster, they pay quickly to start the process, and do not question if I ask for more money down the line. Since, unfortunately, the family law landscape usually has women opening the divorce and men defending it, men are hesitant to make multiple payments without seeing results. Having said that, on average, women's cases tend to last longer since they tend to ask for more as the case goes on, including child and spousal support, more accommodations, and property. A very sad story I hear too often from men is this: "I've lost my kids, my house, my love, my family, my life. Please don't let me lose my income too." They will pay a lot more money to stop their ex-wives from going after their income. I have legitimately had male clients tell me that if they had to lose $50,000, they would rather give that to me than to their ex-wives. Just a few observations. Even though I am not a therapist, I hope my perspective was valued here. Feel free to ask questions. Story 32. I am not a therapist, but I provide mental health assessments. Mostly, men are not in tune with their emotions, and it takes time for them to acknowledge these changes. Some may even deny them, while women are generally more aware and readily acknowledge and accept their emotions. Story 33. I am a school counselor working with children aged 5 to 18 years and a trainee psychologist. Our statistics show that boys are more likely to be referred to me for behavior issues, while girls are more likely to self-refer for help with mental health and friendships. For my long-term students, our conversations become fairly non-gendered. They start based on their presenting issues but evolve over time. We have developed such a strong relationship with the students that when I go to collect one from class, I hear, "Miss B, is it my turn?" and receive many self-referrals in the playground. I hope we can continue to normalize seeking help. All the boys who see me enjoy doing so, and I hope this continues throughout their lives. Story 34. I work with children in play therapy. Boys tend to engage in more aggressive and competitive play, such as sword fights, battles, and games. They are more comfortable expressing angry feelings. Girls typically engage in nurturing and relationship-based play, like dollhouse, babies, and family scenarios. They are more likely to express sadness. Other genders often exhibit a combination of both styles. However, I have not worked with many non-binary children in therapy. Story 35. I'm not a therapist either, but I can also mention some sexist stereotypes if you'd like. Women tend to like the color pink, and men tend to like barbecue. Story 36. Women tend to want to be understood, even without proper communication. Men also tend to want to be understood without proper communication. More women than men are worried about not being in a relationship until around age 50, and then the trend is completely reversed. Men's anger usually stems from insecurity and anxiety, while women's anger tends to be more about feeling misunderstood, disrespected, or treated differently just because they are women. Men with trauma and women with trauma handle it very differently. There are not many differences, honestly. Everyone has challenges they have to deal with. Story 37. I find that when identifying and expressing emotions, male clients more often check my reaction as though they are seeing if it is okay for them to have the emotions or if I am going to dismiss them. Female clients seem to be much more certain that I will be accepting of their emotions and supportive. Story 38. In general, everyone hates feeling or expressing their emotions. Men's emotional comfort zone is anger, and they have difficulties with sadness. Women often have difficulties expressing anger due to stereotypes, double standards, and internalized misogyny. Universally, people are too hard on themselves. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.